Welcome to CSHE's Certified Healthcare Facility Manager Study Guide. In this section of the study guide, we will be reviewing the compliance portion of the test. These topics are taken directly from the CHFM Candidate Handbook. Approximately 25 of the 100 questions on the exam will be on the area of compliance, with 10 of these being the ability to recall or recognize specific information regarding compliance, and 15 questions being the ability to comprehend, relate, or apply knowledge to new or changing situations regarding compliance. Taken directly from the CHFM Handbook, the first area we will be covering is on assuring that code-required testing is completed and documented. The CHFM must maintain the occupancy codes in each building he or she manages, so the buildings can be legally occupied and used. Government officials may conduct periodic inspections of a building and its specific equipment. Electrical switches and fire protection equipment are tested at regular intervals to ensure they are in good working order. If the government finds non-compliance during an inspection, then it issues a warning and may revoke the certificate of occupancy if the situation is not corrected. Fire protection equipment is rarely used, so it must be regularly inspected and tested to determine that it is operable and effective in an emergency. The CHFM designates fire personnel on the maintenance staff or hires a fire contractor to perform the maintenance and testing, and then the CHFM keeps a central file of the associated training, manuals, and testing. Next is ensure compliance with legal, regulatory, guidance documents, and accreditation standards or codes to include design, operations, maintenance, and construction issues. The American Institute of Architects, or AIA, is the leading professional association for licensed architects in the USA and Canada and provides a comprehensive collection of contract documents dealing with the complete range of design and construction for both large and small projects. AIA publishes the guidelines for design and construction of healthcare facilities, which can be found at the website located at the bottom of the screen. Concepts in that book will likely be covered during the exam, and therefore potential CHFM test takers should review the AIA published book before the exam. Model building codes are developed and maintained by standards organizations that do not have jurisdiction over enacting and enforcing the codes, but may offer consulting services to the users of the codes. State and local governments often adopt specific portions of the model building codes, usually the electrical, plumbing, and fire codes. Some examples are shown on the screen. A CHFM is responsible for following the codes that pertain to the municipality, county, and state in which the facility operates, rather than a model building code, and it should be noted that the questions on the CHFM exam are nationally recognized concepts, and many of the regulations that are followed in states like California are often more stringent. Be sure to read the question carefully and ensure not to apply localized regulations to questions on the exam. ADA is a federal anti-discrimination statute intended to extend to qualified persons with disabilities the same opportunities for employment and advancement that are available to able-bodied workers. ADA requires that an employer make reasonable accommodations to enable the disabled person to perform the tasks of a job. However, it does not excuse the disabled person from performing those tasks to the same standards that are expected of workers who are not disabled. Accommodations are not standardized for specific positions, but must be tailored by each employer to fit each disabled worker. The Environmental Protection Agency, or EPA, is a federal government agency charged with the regulation of chemicals and the protection of human health through the safeguarding of the water, air, and the land. The EPA enforces national environmental laws, and the two areas of medical waste that are major concerns for the EPA are hospital incinerators and regulated medical waste. The CHFM must follow health regulations by the federal EPA, OSHA, CDC, and DOT, and various state regulations. The CHFM can get assistance with pollution prevention and compliance through the Healthcare Environmental Resource Center at the website shown on the screen. The Joint Commission, formerly the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, is a national not-for-profit organization that accredits and certifies healthcare programs and organizations through peer reviews. Its mission is to improve patient safety and quality of care. The Joint Commission sets standards for accreditation and competencies for healthcare workers regarding infection control, visiting rules, background checks, medical records, and many others. The Joint Commission issues national patient safety goals annually, and the Joint Commission requires quality management and risk management to be linked. The Joint Commission established core measures to determine if healthcare institutions comply with current standards, and it makes the results of its accreditation surveys public. The National Fire Protection Association, or NFPA, is an international non-profit organization that publishes more than 300 codes and standards to reduce fire risk. NFPA is the leading international advocate for the prevention of fire. The organization impacts the healthcare industry through its codes and standards, especially the Life Safety Code. OSHA is the U.S. Department of Labor's Occupational Safety and Health Administration. OSHA works with the EPA to develop federal regulations that safeguard the health and safety of American workers. Healthcare facilities are required to adopt OSHA regulations as part of your standards of practice. Visit their site shown on the screen for updates and to download record-keeping forms. Some of the areas OSHA mandates include those shown on the screen. Note that you should be specifically familiar with the bloodborne pathogen standard that protects workers from hepatitis, HIV, and other infections spread through contact with bloody aerosols and contaminated sharps, as it could possibly be covered on the exam. The Centers for Disease Control, or CDC, are a major component of the U.S. Department of Health and Human Services. The CDC impacts facility management because it develops and provides guidelines to prevent infections among workers in healthcare establishments. The CDC provides information about outbreaks, emergency preparedness, natural disasters, severe weather, food recalls. In addition, some major concerns of the CDC are hand hygiene, the exposure of workers to hazardous drugs, chemicals, waste, and communicable diseases, and occupational injuries such as back injuries, allergies, cuts, and needle sticks. Additional information can be found at the web address on the screen. The Centers for Medicare and Medicaid Services, or CMS, is a federal agency within the U.S. Department of Health and Human Services. CMS develops conditions of participation and conditions for coverage that healthcare organizations must meet in order to begin and continue participating in the Medicare and Medicaid programs. Conditions of participation and conditions of coverage are the minimum health and safety standards that providers and suppliers must meet in order to be Medicare and Medicaid certified and receive reimbursement. Next, we will cover ensuring that healthcare facility permits, licenses, and certificates are maintained, recorded, and current. First, building permits. The general contractor for the project must obtain a building permit before construction can start on a new building or a renovation project involving construction. Building permits are mandated by the local government and depend on compliance with the applicable zoning regulations. Subdivision regulations may also apply. The building permit may reference local codes dealing with electrical, plumbing, mechanical, structural, and life safety code. The local building inspector must approve the construction documents, which the general contractor has submitted as a complete set, before the local government issues a building permit. Regular inspections of the work occur as the project progresses. The project must comply with all applicable requirements before a certificate of occupancy is issued. Elevators are an important subject and will likely be covered on the CHFM exam. The facility manager is responsible for ensuring all elevators and other equipment for moving people and freight are kept in safe operating condition by ensuring that routine maintenance and tests are performed by a staff person or contractor certified for that duty. Second, ensure that the required operating signage and passenger instructions are posted correctly. And third, monitoring the operation of the equipment and document his or her observations. Another important point is ASME A17.1, 1996 Safety Code for Elevators and Escalators, which tells us the following: instructions for what to do in case of fire. Freight elevators must contain statements of capacity and an indication of whether they are freight only or may carry passengers. Dumbwaiters should have signs indicating that they are to be kept closed and that they do not carry passengers. Escalators should have signs that tell passengers to hold the handrail and to attend children. An emergency stop button should also be clearly indicated. Next, ensure that all healthcare facility staff licenses and certificates are maintained, recorded, and current. Licenses or certifications are required for several types of facility maintenance work, including those shown on the screen. A license for personnel who handle or purchase refrigerants, particularly chlorofluorocarbon-containing refrigerants, is available through an exam administered by the EPA. It is important to note that the CHFM is responsible for the qualification of mechanics or workers, which can be verified through competencies displayed by the workers. Next, evaluating space environmental conditions. A healthcare establishment must provide a clean, safe environment for its workers, clients, and patients. Much of the indoor environment is determined by the ventilation of the space and must take into consideration code requirements, size of the space, number of occupants, and how the space is used. The term sick building syndrome, or SBS, is used to describe situations in which building occupants experience acute health and comfort effects that appear to be linked to time spent in a building, but no specific illness or cause can be identified. The complaints may be localized in a particular room or zone, or may be widespread throughout the building. In contrast, the term building-related illness, or BRI, is used when symptoms of diagnosable illnesses are identified and can be attributed directly to airborne building contaminants. Some known causes are inadequate ventilation, chemical contaminants from indoor or outdoor sources, biological contaminants. Next, reviewing fire events by category. There are very specific factors that must be reviewed after a fire. 1. Review the event and determine what went wrong and what was done right. Next, determine if the affected building or the section in which the fire occurred met all applicable codes. Next, determine if improvements are needed in the fire suppression systems or on the fire response training program. Next, determine if the handling procedures for hazardous material or equipment should be changed. Determine the exact cause of the fire in collaboration with the fire marshal. Next, take steps to prevent a recurrence. Ensure that the fire alarm system is adequate and that it functions properly. finally, review escape routes. Next, conducting fire training for staff. In regards to fire training, CHFMs should provide fire training reinforced with periodic fire drills, establish evacuation routes with fire personnel and post maps of the routes in each area of the building. Ensure staff are knowledgeable of the locations of alarm pull stations and how to activate them. Ensure staff practice in the use and operation of handheld extinguishers. Keep a permanent log of fire training. An important point to note is that operations personnel must know where specific monitoring panels are located and should have a thorough knowledge of the protocols for shutoff valves and disconnects. There are two main types of teams that respond to fires. The first is the in-house fire response team, which is a group of employees trained in the use of firefighting equipment. They are able to respond to a fire emergency until the local fire department arrives. A minimum of 2 persons from each shift is usually included in the in-house fire team. The in-house fire team's duties are to have hands-on experience with the equipment, be familiar with the locations of all exits, evacuation routes, and procedures, know how to operate the alarm system, and they may be trained in first aid and CPR in case of injury. The second type of team that can respond to fires is the in-house fire brigade, which is a group of employees trained according to OSHA standards to actually fight structural fires. Needed in medical facilities that are not located near enough to a local volunteer or a municipal fire department for quick response. And they are trained at an approved school for firefighters and have access to proper personal protective equipment, or PPE, and also firefighting equipment. Fire response team is more likely to be used than a fire brigade. However, isolation hospitals for communicable diseases, biosafety level 4 laboratories, and maximum security hospitals for dangerous offenders may use brigades. Next, coordinating corrective action for compliance with fire safety codes. Systems that will need to be maintained in compliance include alarms, automatic sprinklers, door closers, elevator emergency controls, emergency lighting, HVAC systems, maps of evacuation routes and fire safety diagrams, and smoke controls. Next, coordinating with the fire department for inspections and touring of healthcare facilities. The CHFM is directly responsible for coordinating inspections and ensuring compliance with local fire department needs and codes. Deficiencies identified with local fire authorities must be corrected in a timely fashion to ensure the safety of building occupants. Next, ensuring code compliance through inspections of specific areas. Facility managers must coordinate monthly inspections and weighing of all portable fire extinguishers in the healthcare facility to ensure they have not lost any of their chemical content. Wet chemical extinguishers receive a hydrostatic test every 5 years. Halon replacement, dry powder, and dry chemical extinguishers undergo a hydrostatic test every 12 years. Tamper seals are placed on extinguishers that pass the test so that a visual inspection can indicate that there has been no unauthorized use. Arrange with emergency services the annual testing of heliport extinguishing systems as the landing pad is closed and medevac patients must be rerouted to another hospital until the test is complete. Next, coordinating emergency management with the community. Healthcare facilities get a full tiered response, including police, fire department, and ambulance, for the reasons shown on the screen. The CHFM ensures staff are trained to recognize color code announcements, such as code red for a fire. Vertical and horizontal evacuation plans are in place for each floor. The definition of a vertical evacuation is evacuation using a stairwell, not an elevator, to allow persons within building to exit the building or facility in cases of emergency. And a horizontal evacuation can be defined as relocation from one area or building to another through fire doors, stairwells, or ground floor exits without having to use stairs or elevators. Also, the CHFM ensures community agencies and volunteers are alerted. And finally, utility companies and vendors are contacted for support and extra supplies. An additional definition you will likely need to know for the exam is area of refuge, which can be defined as an area that can be used as part of the required means of egress for persons that are disabled. These areas located on floors above or below the building's exits can be used by disabled persons until rescue can be facilitated by the fire department. When a natural disaster strikes a community, the Multi-Agency Coordination System, MACS, responds, which can include EMS, Red Cross, military, community agencies, public health agencies, and even the CDC. Standardized emergency management systems is used for natural disaster preparedness, mitigation, response, and recovery. Incident command system is used by the facility to ensure the appropriate roles are established for a disaster. Next, managing the fire safety program. The fire safety program includes fire prevention by identifying and removing or controlling hazards, maintenance of smoke and fire alarm systems and fire suppression systems, employee training, regular monthly testing of safety equipment, developing evacuation plans and posting routes. One point that may not be normally thought of, but could potentially be on the test, is intruder alerts. Another is monitoring employee behavior during a fire, liaison with helper agencies, debriefing, and finally recovery. Next, managing fuel oil storage systems. National and local codes cover the storage and handling of fuel oil, including the amount of fuel that is allowed to be stored at the facility, whether it must be stored in above ground tanks or in tanks underground, the type and size of piping that must be used to move the fuel from storage to the point where it is burned. In some situations, oil burning equipment may be located in a basement, with the fuel storage also inside. This situation must also meet the safety standards set by the local codes. In most cases, the local codes are based on those established by the NFPA Code 30 and the U.S. Department of Transportation, or DOT. Next, checking work of staff to ensure compliance with applicable safety and building regulations and that workmanship meets quality standards. Supervisors should inspect and evaluate the work of facility workers and contractors to ensure that any maintenance and repairs performed do not violate code requirements. Regular inspections and feedback are required for proper annual and probationary performance appraisals, pay raises, bonuses, and promotions. Evaluation can be used as the basis for setting individual goals for the next evaluation period. New hires usually have an evaluation at the end of the probationary period, which is typically 3 months or 6 months, and then annually thereafter. The facility manager or designee is responsible for daily inspections in the following areas. Food, which typically has preparation services and ensuring they're clean, making sure raw food is stored and handled with proper care, and that meals are served on time and at the proper temperature. Electrical and HVAC, making sure that repairs and maintenance of building systems must be performed by licensed workers to standards set by local codes. Housekeeping, making sure the cleanliness of the facility meets the standards of the infection control and quality assurance teams with regard to cleaning treatment rooms, disposing of clinical waste, and disinfecting common areas. Groundskeeping, making sure that lawsuits are avoided because staff use due diligence when clearing snow, posting warning signs, and securing slippery areas. In most circumstances, direct observation is the best way to determine that the work is done properly. Next, investigating equipment or utility failures and documenting steps taken to prevent reoccurrence. The CHFM makes the decision to repair or replace essential building equipment when it fails. 4 factors should be evaluated. The cost of replacement versus cost of repair. Be sure to include the time for in-house personnel to repair the item plus any downtime caused by the item being out of service. Contracting out. If the item cannot be repaired in-house, consider the cost of increased downtime of having it repaired by an outside agency, the confidentiality issues, and existing contracts. Third, cascade failure. An example of this is when a small piece of medical equipment that was bought in bulk fails. Inventory other similar items of the same age that may fail in the near future. Finally, bulk purchase discounts. Vendors may offer cost discounts for purchasing several of the items likely to fail soon. So it may be cheaper to replace all of them at once rather than waiting for each to fail sequentially. Next, managing asbestos and mold abatement efforts. Asbestos is a fibrous mineral that was used before the 1970s as a fire retardant and insulator in building materials. Asbestos needles were usually combined with other materials through the use of strong bonding agents. Bonded asbestos is usually safe. However, when bonded materials become crumbly or damaged, they release fibers into the air that, when inhaled, cause lung cancer, asbestosis, and mesothelioma. Occupational diseases from asbestos exposure do not appear immediately, but develop many years later. Maintenance activities that can cause a release of fibers from an asbestos-containing material are shown on the screen. Gaskets that contain asbestos can release fibers if they become worn. If an inspector determines that a facility has asbestos-containing materials, an abatement program by specially trained workers wearing PPE may be required. Once an inspector determines that asbestos is present in a building, an abatement program is needed. The most frequent method of eliminating the hazards of asbestos exposure is the removal of all asbestos-containing material under a containment tent and disposing of it as a toxic waste. Depending on local codes, some materials may be enclosed or encapsulated. While in-house staff may be trained to abate asbestos, it is usually best to hire a reputable professional contractor to handle the project. Local codes may require that only certified persons handle the asbestos and dictate the disposal method. The CHFM carefully maintains a record of all asbestos abatement efforts for the EPA, OSHA, and accreditation surveys. Molds are fungi that grow in dark, damp places below 77 degrees Fahrenheit with humidity above 70%, such as between dividing walls, behind panels, and in canals. There are 200,000 harmless species of mold. Shown on the screen are species of mold in the USA that are harmful to human health. Water damage in a building encourages mold growth. Mold may or may not produce a scent. Molds can cause skin rash, memory loss from brain damage, leukemia, and cancer of the kidney, liver, and esophagus. Identify discolored areas indicating water seepage and condensation. People with compromised immune systems, allergies, asthma, and sinusitis are most at risk. Mold seriously affects infants and children, the elderly, and pregnant women. Therefore, concentrate your search in respiratory, obstetrics, pediatric, and gerontology wards. Referring to abatement programs, prevent mold growth and promote quick cleanup when mold is found. Areas prone to developing mold include air conditioning ducts, humidifiers, vinyl wallpaper over drywall, floor drains, basements, attics, bathrooms, kitchens, mattresses, foam pillows, carpets, upholstery, and garbage chutes and containers. Next, managing hazardous materials. Hazardous waste produced by healthcare facilities can contain toxic chemicals, radioactive materials, and byproducts of patient testing and treatment. Clinical waste includes items contaminated with potentially infectious body fluids, sharps and body parts, or expired medications. Sharps require a locked disposal container and must be separated from other items. Healthcare organizations utilize 4 basic approaches to the control of hazardous waste. First, minimize exposure at the point of waste production. Establish good procedures tailored to the area, especially the operating room, pharmacy, laboratory, and patient care areas. For example, drug addicts search garbage for needles and medications, so secure outpatient clinic garbage. Next, clean and remove. Housekeeping is responsible for checking all areas on a schedule, and staff must report spills and contamination as they occur. Cleanup techniques are specific to the risks of the materials involved and may require specially trained staff with the correct PPE. Establish routines according to OSHA's bloodborne pathogen standards is the third. Patients, staff visitors, EMS personnel, and intruders who were exposed to hazardous waste must all undergo decontamination and prophylaxis or follow-up. And finally, epidemiologic study. Whenever the hazardous waste control program fails, alert the risk manager, safety officer, infection control, security, and public health as appropriate to the situation. Procedures for handling, storing, and disposing of hazardous materials falls under both federal and local codes and falls directly under a CHFM's purview. Next, managing compliance with the Life Safety Code. NFPA 101. The Life Safety Code is a document published by the National Fire Protection Association, or NFPA, which sets standards for both existing buildings and new construction. According to the NFPA website, the Life Safety Code is concerned with those construction, protection, and occupancy features necessary to minimize danger to life from fire, heat, and toxic gases created during a fire. The code also sets minimum standards for exits in order to allow occupants to escape promptly from buildings. Other items covered by the Life Safety Code include maintenance activities, protective systems, and operating features. Life safety walkthroughs should be conducted by the CHFM or by another qualified designee per the hospital's policies and procedures. Next, we'll be reviewing managing the safety program. Safety programs must comply with OSHA, including specific record keeping by employers, limiting access to work areas, strictly control access to hazardous areas, post warnings of danger in appropriate areas. Encourage staff to take care not to create unnecessary hazards by placing equipment or other trip hazards in traffic paths. And work areas should be cleaned promptly. Familiarize yourself with OSHA's free online tool that helps you design your own safety program correctly, located at the website shown on the screen. Next, coordinating with physicians, departmental managers, and outside agencies in the development of plans to manage emergencies affecting healthcare facilities. Emergency preparedness plans are made according to the standardized emergency management system. Each administrator and department head knows exactly what he or she is expected to do in SEMS and where the Incident Command Center will be. Typically, the CHFM oversees the rearrangement of space to accommodate a triage area and the larger number of patients. The CHFM must understand work refusal and work stoppage policies and procedures. Duties are shifted or rearranged so that the care of current patients will not be interrupted by the influx of disaster victims. The CHFM works with engineering and operations to make arrangements for backup utilities as needed. Next, notifying the safety committee of actual and potential problems. Every healthcare organization must establish its own patient safety committee, charged with maintaining safe delivery of patient care. The Environment of Care Committee is a type or subsection of the Safety Committee that is more concerned with the physical environment of the building and grounds, especially the reduction and elimination of fire hazards and the causes of accidents. The CHFM works closely with the latter committee to deal with incidents or with potential problems as they are identified. It is important to know that a walkthrough must be completed in all areas every 6 months. The CHFM deals with the safety officer, a full-time safety coordinator. The safety officer ranks highly within the organization and has authority to make safety decisions and change processes. The safety officer helps the CHFM to arrange for staff training inspections, organize safety teams, assess risk, measure performance, contact external agencies and internal stakeholders, write policies and procedures, and maintain the error reporting system. Next, managing the security program. The security service of a healthcare facility provides protection for employees, clients or patients, and the property in the form of investigating threats of violence and acts of theft and vandalism. Next, monitoring property open to damage and looting, such as during a natural disaster. They also provide traffic control, access control, identification of personnel. They also create an environment that is reassuring to persons with a legitimate reason for being at your facility. They discourage disruptive, violent, or destructive behavior. Employing uniformed guards who are either in-house employees or from a contracted service. And finally, working closely with local fire and law enforcement organizations. A good security system is composed of 3 basic elements. The first is personnel. Security officers are usually uniformed, so they are easily recognizable, but occasionally they are undercover. Security officers are responsible for enforcing the hospital's policies and procedures. They deal with problems, including alarms, and investigating accidents and incidents. Second is devices. These can include both indoor and outdoor lighting, alarms of various types, emergency call boxes in common areas such as parking lots, and locked doors to restricted areas. The final element is policies and procedures. Policies and procedures establish the limits for access and movement at the hospital. Policies and procedures detail the proper response to particular situations in the correct sequence, including identifying and reporting problems. Next, maintaining the Joint Commission's Statement of Conditions document. Every Joint Commission accredited healthcare facility must comply with the Joint Commission's electronic Statement of Conditions as of September of 2007. The CHFM completes the ESOC questionnaire online at the website shown on the screen. The SOC compliance document was developed to help create and maintain a fire-safe environment of care and demonstrate compliance with the intent of standards that require newly constructed and existing environments of care be designed and maintained to comply with the Life Safety Code. The Statement of Conditions document has 4 parts, which will be covered later and must be updated on an ongoing basis as changes occur. Next, inspecting healthcare facility buildings and grounds to ensure compliance with standards and regulations. The walkthrough itself entails visual inspections of building areas and consultation with occupants and staff, including safety, code compliance, staff knowledge, building conditions, and fire and life safety features. Next, developing a program to manage medical equipment. The goal of the equipment repair program should be preventive rather than the fixing of broken items. Items should be withdrawn from service and maintained or replaced before they actually break. Logs should be kept of all servicing and the replacement of parts. If there is no medical engineering department, staff members in each department may be trained in the repair of clinical equipment, but it is likely that such items will be sent to an outside repair service. Next, developing a program to manage utility system equipment. It is vital that the equipment for critical utilities be properly maintained, repaired, and replaced as needed. Some such systems are air, water, and steam. Critical areas must have an uninterruptible power supply. A licensed boiler operator is required for the higher levels of steam pressure. Isolation rooms require filtered air and piped-in oxygen and suction. And ideally, electric power should be supplied from at least 2 separate substations, with emergency backup power available from on-site generating equipment. Next, we will be looking at conducting hazard survey tours. The Safety Committee conducts hazard surveys. The hazard survey involves a walkthrough inspection of a particular part of a facility or of the entire facility. Members that should be included on the walkthrough are risk managers, infection control nurses, quality assurance managers, safety officers, and representatives from maintenance and operations to provide keys and lead the committee members through the building. The committee should make note of items and situations that pose a danger to personnel, patients, or visitors. Noted hazards range from items out of place that could cause someone to trip or that block a passage to something that is a fire hazard. The department supervisor follows up immediately to correct hazards located by the survey team and reports back to the safety committee. Next, creating the following for the Joint Commission inspections. Statement of Conditions. The Statement of Conditions compliance document consists of the following 4 parts. Part 1, Introduction and Instructions. It contains general information and guidance to aid you in completing Parts 2 through 4. Part 2 is the BBI, or Basic Building Information. It collects general information about each building occupied by patients, residents, or clients. Part 3 is the Life Safety Assessment. It assesses your organization's general compliance with the requirements of NFPA 101-2000, Life Safety Code. Part 4 is the Plan for Improvement. It describes your organization's plan to resolve identified Life Safety Code deficiencies. It is important to note that the SOC must be updated on an ongoing basis as changes occur. The second section is Plan for Improvements. All Life Safety Code deficiencies identified in the Life Safety Assessment must be corrected. Any of the following improvement actions may be used to resolve identified deficiencies. The first is to perform all work necessary to meet Life Safety Code requirements. Second, request an equivalency from the Joint Commission. And third or final, develop a plan for improvement whenever the resources currently available to your organization preclude you from immediately accomplishing either one or two above. An option for managing deficiencies is to create a PFI for all known deficiencies as they are discovered or created, no matter how large or small they may be. This can be a cumbersome process. The Joint Commission allows the use of a work order system or other type of documentation to record deficiencies and to document their correction if they can be corrected within 45 days. This process is likely to be much easier to manage than opening a PFI for deficiencies that can be corrected immediately or within a short time frame. Next, creating deferred maintenance schedules and projects. Deferred maintenance means repairs and cleaning that are put off until a later date. Such a delay may be necessitated by budget restraints, timing, or the temporary unavailability of a part, but should not occur because of negligence. Deferred maintenance should not be allowed to become a hazard to health, safety, security, or the environment. The deferred item should remain on the maintenance schedule so that it is not forgotten and management is aware that it has not yet been serviced. Accreditation surveyors inquire about deferred maintenance. If an item is not compliant, then it may result in preliminary denial of accreditation. Hospitals typically have 90 days following the survey to successfully address all requirements for improvement. Next, participating in emergency drills and training. Hospital staff rehearse their responses to emergency codes through regularly scheduled drills. Fire drills are rehearsed monthly under the safety officer's directions. Various types of drills are shown on the screen. Elaborate mock disasters are drills used for training EMS personnel, meaning fire, police, and ambulance, at the hospital, usually on an annual basis. Next, we will be going over some various study questions. Note that some of the questions may seem dated, but many of the topics are still covered in the CHFM exam, so individuals should familiarize themselves with the subjects. What does Joint Commission require to complete the Statement of Condition and Plan for Improvement? A, an architect experienced in healthcare design. B, a fire protection consulting engineer. C, the director of engineering. Or D, an individual with extensive knowledge of the facility and fire codes. Answer D is the best answer here. The Joint Commission does not prescribe that an individual with specific education or credentials completes the Statement of Conditions. It does prescribe that the individual have extensive knowledge of the facility and fire codes. The Statement of Conditions, or SOC, must be updated A, at each EOC safety meeting, B, annually, C, every 3 years, or D, as building changes occur. D is the best answer here. According to the Joint Commission, the SOC should be updated on an ongoing basis to adequately reflect the current life safety features and deficiencies of the building. Which of the following Joint Commission standards requires a facility manager to provide for ongoing education and training to improve and maintain staff competence? Is it A, environment of care, B, human resources, C, leadership, or D, performance improvement? Answer B is the best answer here. This requirement is clearly delineated in the Human Resources section of the Joint Commission standards. A facility manager is preparing to install a two-way communication system between elevator cars and a central control point. The facility manager should see that communications wiring is protected to ensure operation for a minimum of how long in the event of a fire? Is it A, 20 minutes, B, 45 minutes, C, 60 minutes, or D, 90 minutes? Answer C is the best answer here. According to NFPA 101, communication wiring shall be protected to ensure at least 60 minutes of operation in the event of a fire. Detailed information concerning maintenance requirements for emergency power systems is contained in NFPA A 72, B 99, C 101, or D 110. Answer D is the best answer here. NFPA 110 is titled The Standard for Emergency and Standby Power Systems and contains information about emergency power system maintenance. NFPA 72 is the National Fire Alarm Code and does not contain information about emergency power system maintenance. NFPA 99 is titled Healthcare Facilities and contains basic information about emergency power systems, but does not contain information about emergency power system maintenance. NFPA 101 is the Life Safety Code and does not contain information about emergency power system maintenance. Which of the following life safety features of a healthcare facility may be applied to Joint Commission's building maintenance program? 1, smoke barrier walls, 2, exit lighting, 3, fire door hardware, and 4, fire alarm system. And they are looking for 3 of the 4 answers. Answer A is the best answer here because answers 1, 2, and 3 are all true. According to Joint Commission statements of condition, smoke barrier walls, exit lighting, and fire door hardware meet the criteria for Joint Commission's building maintenance program. Number 4 is false. When deficiencies are found in a fire alarm system, they must be corrected immediately or interim life safety measures must be put in place. Next, portable space heating devices are allowed in healthcare occupancies when which of the following criteria are met? 1, the device is placed in staff or employee areas. 2, the device is placed in occupied patient rooms. 3, the temperature of the heating elements do not exceed 212 degrees Fahrenheit. Or 4, the temperature of the heating elements do not exceed 175 degrees Fahrenheit. And they are looking for 2 of 4 answers. Answer A is the correct response here. Answers 1 and 3 are both correct. According to NFPA 101, portable space heating devices shall be permitted in non-sleeping staff and employee areas – where the heating element does not exceed 212 degrees Fahrenheit. A multidisciplinary improvement team or safety committee meets at least bi-monthly to address environment of care issues. Meetings held less frequently than bi-monthly are acceptable when supported by the number 1, organization's experience, 2, budget constraints, 3, improvement team's approval, and 4, staffing requirements. And they are looking for 2 of 4 answers. Answer A is the correct response here, because answers 1 and 3 are both correct. According to the Joint Commission, an organization can perform an assessment of risk if changes need to be made. An assessment must be agreed upon by the multidisciplinary team and be reviewed annually after the initial evaluation. When installing an electric fire pump, the pump should be provided emergency power by which of the following means? A, emergency system transfer switch. B, equipment system transfer switch. C, essential electrical system transfer switch. D, direct tie to the generator. Answer D is the best answer here. According to NFPA 70, fire pumps must be tied into the emergency power distribution grid without any interruptions, other than an independent transfer switch. Between what hours of operation is it permitted to make a code announcement rather than using an audible alarm while conducting a fire drill? Is it A, 8 p.m. until 7 a.m., B, 9 p.m. until 6 a.m., C, 9 p.m. until 7 a.m., D, 10 p.m. until 6 a.m.? Answer B is the correct answer here. According to NFPA 101, when drills are conducted between 9 p.m. and 6 a.m., a coded announcement shall be permitted to be used instead of audible alarms. Joint Commission standards require that the effectiveness of fire response training be evaluated at least A, quarterly, B, semi-annually, C, annually, D, every 2 years. Answer C is the best answer here. Joint Commission hospital accreditation standards require an annual evaluation of the response training to the fire plan. Next, a facility is installing an automatic fire alarm system. According to NFPA 101, which of the following are acceptable means to notify the emergency forces in case of an emergency? Number 1 is an automatic tape dialer connection. Number 2 is an auxiliary alarm system. Number 3 is a central station connection. And number 4 is remote station connection. And they are looking for 3 out of the 4 answers. Answer D is the correct response. Number 1 is false. An automatic tape dialer connection is not a specified approved method of notification, meaning that number 2, 3, and 4 are all true. According to NFPA 101, an auxiliary alarm system, central station connection, and remote station connection are listed as acceptable. Fire drills in healthcare facilities shall be conducted A, monthly on each shift, B, quarterly on each shift, C, semi-annually on the day shift and quarterly on other shifts, D, annually on each shift. Answer B is the correct answer here. According to NFPA, drills shall be conducted quarterly on each shift. Which of the following is not an organization that has developed a model building code? Is it A, the UBC, B, the SBCCI, is it C, the RBC, or D, the BOCA? Answer C is the correct answer here. RBC stands for the Royal Bank of Canada, which has not developed a model building code. The Uniform Building Code, or UBC, the Southern Building Code Congress International, or the SBCCI, and Building Officials and Code Administrators, or the BOCA, are all organizations that have. One area that certified healthcare facility managers should concentrate their mold abatement efforts on is the A, detoxification ward, B, the fuel oil storage tank, C, the nurses station, or D, the gerontology ward. Answer D is the best answer here. The elderly are very sensitive to mold and can suffer more serious consequences if infected. Others groups are highly sensitive to mold are infants, pregnant women, and those with respiratory problems. HVAC workers who handle refrigerants containing chlorofluorocarbon, or CFCs, are required to pass a certification exam administered by which agency? A, the ADA, B, OSHA, C, the EPA, or D, the NFPA? Answer C is the best answer here. CFCs are known to cause depletion of the ozone layer in the Earth's atmosphere if released into the air. So the EPA, or the Environmental Protection Agency, administers the exam. The answer A, or ADA, or the Americans with Disabilities Act, is not an agency. Answer B, or OSHA, the Occupational Safety and Health Administration, oversees worker health and safety. Answer D, or NFPA, or National Fire Protection Association, has codes to reduce the risk of fire. So answer C is the best answer here. A healthcare facility fire safety program should include all but which of the following? A, monitoring employee behavior during a fire. B, NFPA Code 30. C, identifying and removing or controlling hazards. Or D, intruder alerts. Answer B is the best answer here. NFPA Code 30 only establishes guidelines for the storage of flammable or combustible liquids. Answer A, monitoring employee behavior during a fire is important so that patients and their confidential records are protected. C and D, identifying and removing or controlling hazards and intruder alerts are crucial to fire prevention. The Joint Commission is A, a nonprofit organization that provides information on rheumatic diseases. B, a new ADA regulation proposed by the Department of Health and Human Services. C, an organization that strives to improve patient safety. Or D, the agency which issues the final ruling in OSHA complaint cases. Answer C is the best answer here. The mission of the Joint Commission, formerly called the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, is to improve patient safety and quality of care. The facility manager is responsible for all of the following duties related to fire safety, except A, posting maps of evacuation routes in all buildings. B, hiring a fire contractor. C, knowing where specific monitoring panels are located. D, keeping a detailed log of fire training. Answer C is the correct answer here. Knowing where specific monitoring panels are located is the responsibility of maintenance and operations personnel, not the facility manager. The CHFM should post evacuation routes, can hire a fire contractor or designate an in-house fire team, and must keep a permanent log of all fire training. Next, a full-time safety officer helps the CHFM to do which of the following? A, direct an in-house fire team. B, develop a fire brigade. C, protect patients from radiation leaks. Or D, maintain the error reporting system. Answer D is the best answer here. The safety officer helps the CHFM organize safety teams, assess risk, and maintain an error reporting system. Directing an in-house fire team is the responsibility of the chief engineer or the director of security. A fire brigade is a group of employees trained in accordance with OSHA standards to actually fight fires. Protecting patients from radiation leaks is an EMS duty. So answer D is the best answer here. Next, the NFPA 101 or Life Safety Code is A, related to public access to laboratories, drug cupboards, and morgues. B, a standardized emergency management system designed to accommodate a triage area. C, related to construction, protection, and occupancy features that minimize fire-related dangers. Or D, about establishing routines that follow OSHA's bloodborne pathogens standard. C is the best answer here. The Life Safety Code is a document published by the NFPA that sets standards to minimize danger from fire, heat, and toxic gases. Choice A refers to measures taken after an incident to prevent looting. SEMS is a standard for national disaster preparedness, mitigation, response, and recovery. And OSHA's bloodborne pathogen standard is a routine that must be followed when dealing with hazardous waste. A CHFM would need an in-house fire brigade in which of the following situations? A, to coordinate emergency management with the community. B, to develop an alternate plan when evacuation routes are blocked. C, when based at an isolation facility for patients with communicable diseases. Or D, when items are contaminated with infectious clinical waste. Answer C is the correct answer here. An isolation facility not located close to EMS and fire personnel would be most likely to have an in-house fire brigade. Emergency management is coordinated through SEMS, the Standardized Emergency Management System. Facilities should always have an alternate evacuation route, and disposal of clinical waste is regulated by federal law. So answer C is the best answer here. Which of the following is not required by the ASME Safety Code for elevators and escalators? Answer A is dumbwaiters must have signs indicating they are to be kept open for security reasons. Answer B is freight elevators should have signs indicating the types of goods they can carry. Answer C is escalators must have signs telling parents to hold children's hands. Answer D is passenger elevators should have signs indicating AIA compliance. Answer B is the best answer here. Freight elevators must have signs indicating if they are for freight only or can carry passengers also. Dumbwaiters should have signs saying they are to be closed when not in use. Escalators should have signs telling passengers to hold the rail and to hold children's hands. The AIA, or American Institute of Architects, is a professional association for architects, and passenger elevators should have signs indicating AIA compliance. Why was the Joint Commission's Statement of Conditions, or SOC, developed? A, to enable state or local authorities to enforce compliance with NFPA. B, to enable CHFMs to follow OSHA guidelines more easily. C, to help CHFMs create and maintain a fire-safe environment. Or D, to coordinate with the fire department for inspections. Answer C is the best answer here. The SOC is a document that was developed to help CHFMs create a fire-safe environment and demonstrate compliance with the Life Safety Code. NFPA is a nonprofit agency that publishes codes and standards. It is not involved with enforcement. OSHA is concerned with protecting worker safety. Coordinating with the fire department for inspections is the responsibility of the facility manager and is not mandated in a document. Which of the following is not a duty of personnel who handle medical gases? A, changing the fittings on the gas cylinders. B, learning to recognize color-coded gas labels. C, inspecting fittings before connecting them. D, storing medical gas cylinders apart from industrial gases. Answer A is the best answer here. Fittings on medical gas cylinders should never be changed. Maintenance personnel must memorize the color-coded gas labels to avoid connecting the wrong gas, which could result in injury or death. Fittings should be inspected before they are connected to make sure they are not worn, which could cause leakage. Industrial and medical gases should be stored in separate areas to avoid a mix-up. This concludes CSHE's study guide for the Certified Healthcare Facility Manager exam.